In this episode of the Cole Memo, I'll be sitting down with Dr. Bob Miller. Dr. Miller works at a cannabis testing lab that is licensed in the state of Illinois and I believe has operations across the United States, but we'll get into that. This is the Cole Memo. I am your host, Cole Preston. Every episode is released in audio, video, and transcript format. To find the audio, video, or transcript version of any episode, please refer to the description of the episode that you're listening to now. Within that description, you'll find a link that will take you to our website, which will display the transcript for this episode and the platforms where you can find this episode in audio or video formats. If you're unable to locate the episode description on whichever platform you're listening from, simply note the episode number and visit thecolememo.com. From there, you can use the search functionality to find the corresponding episode, and then you'll be able to access the audio, video, and transcript version of the episode. The new search functionality that I rolled out is in the top right-hand corner of thecolememo.com. You might also find any links that we reference during the episode so that you might be able to do your own research. If you're not listening to this episode of the Cole Memo on Patreon, then you're listening to this episode later than our patrons. To become a patron, go to thecolememo.com/Patreon. It's a great way to support our show, but another way to support our show is at thecolememo.com/support. You can make a one-time monthly or yearly contribution of your choice. That's right. If you have a few dollars to throw my way, you can do that at thecolememo.com/support. But one of the best ways to support our show is absolutely free. Subscribe to or follow our show. Leave us a positive review from wherever you're listening to us from. Favorite this episode. Give it a thumbs up, leave a comment, or post a review. Your engagement and support is appreciated. Enjoy this episode of The Cole Memo. Today is February 21st, 2024. So, I'd like to welcome Dr. Bob Miller onto the show. We'll be talking about a lot of different topics today, but before we do that, Dr. Miller, do you mind introducing yourself to my audience?
Sure. Yeah, Bob Miller. I'm the Chief Scientific Officer for ACT Laboratories. Been with ACT for about 4.5 years. Have about 35 years of experience in the pharmaceutical industry. Heads of quality at multiple companies, including Johnson & Johnson, Pfizer, and most recently Gilead. At the time at ACT Laboratory, came in as the COO of ACT, then became co-CEO, and now I'm focusing on the science as the lead of the CSO.
Awesome. And I'm so excited to talk about some of the science behind cannabis testing today. And there, I just kind of broke what you do. Do you want to tell us you're in Illinois and multiple states, but it's cannabis testing, right?
That's correct. So we are in 6 states. We're in Illinois, Ohio, Pennsylvania, New York, and Florida, in Michigan. I'd say 95% of the work we do is in cannabis. We do also do some hemp testing, but our claim to fame is cannabis testing, correct?
Awesome. Awesome. And I'm just curious before we get into the body of today's subject, can you tell our listeners, how does testing even work?
Yeah, sure. So we take we take our role very, very important. As I say, we're actually the group that ensures the quality and safety of the product before it goes to the consumer. So in all the states that we do business, any product that is marketed to the consumer needs to be tested by an independent laboratory before it can be sold to the public.
Awesome. Yeah. And I guess just to put a finer point on it, one thing that I misunderstood, but had my understanding corrected on was like this joint I have in this little bottle here, for example, it's not tested itself, right? It's that a batch that was representative or a sample that was representative of the batch was tested. Is that correct?
That's correct. So every state, each of them have separate requirements. But with that being said, what is done is defined as when you have, as you can imagine, say a batch is, 5,000 joints. What is done is there has to be a sampling of that, a randomized sampling of that material. And the number of samples that we actually do bring in is really defined by the state. And then we bring that material in and it's tested for a series of things. I always like to think of it as there's really 2 different types of testing that we do. There's the potency test, which is the one that the consumers obviously see that states the level of THC. And then there's a whole series of contaminant or potential contaminant tests that are also done as part of that process.
Gotcha. Gotcha. It's very interesting. And I'm just curious. So it would be like I'm a grower, I'm a licensed grower, and my batch is ready, but I need to get it tested before I put it on the shelves, right? So I call the folks at Act Lab, actlab.com, by the way, for anybody that's interested. And then you come and gather the samples, or do I gather? How does that part of it work?
Yeah. So what happens is, as you might imagine, there's a pretty tight control of how much material is removed and then transported to our facility. So that grow processor will call us and say, I'm ready to have my product tested. They fill up some necessary paperwork. We then go in and take the sample using, again, some predefined procedures to get a sample that's representative of the batch. And then that material is brought back to our lab and tested. What we have to do is we're very particular on how much material we take from the grower processor, and then ultimately how much do we test, and then how much do we ultimately destroy. So that there's a very tight control there. It is also put into what we call the seed to sale system. So the seed to sale system is the tracking system, which would then allow the state to be able to get a feel for what's being tested, who's it for, and what are the results. And then that also creates what we call a certificate of analysis. And a certificate of analysis is really a summary of all the results that we did to test for that specific product.
Very cool. Very cool. So not only the potency testing, but like you say, the what was the other part of the test?
Contaminant testing.
Yeah.
So what, to put a little bit greater detail for the state of Illinois, we do microbiological testing. There's a number of different species that we're testing for. We do mycotoxin testing. Mycotoxin is a toxin that can be released from specific types of mold. So we do mycotoxin testing. We do heavy metals testing, which is a series of different metals that could be inherent in the process. Then we do residual solvents. And again, depending on how that flower is further processed, oftentimes there'll be solvents to extract the cannabis. So there is a test for residual solvents, and then there's pesticides. Those are the series of tests that are required in the state of Illinois.
Gotcha. And maybe that leads us up to the video, the testimony that I saw and maybe that can crack us open to discussion. Does that sound like a good transition to you?
Sure, that's fine.
Cool. All right. I'm going to just play the short video so that people know what we're talking about. And then I'll give you the opportunity to elaborate if that sounds good. So
that'd be great.
For its overall success. I want to talk about one aspect. I apologize. I hopefully won't be too in depth in chemistry, but a situation right now we're living in Illinois. In Illinois today, we have a pesticide test that we cannot do. The test requires us to test for 350 different pesticides. If we were to even get the materials of known purity, it would cost us hundreds of thousands of dollars even to be able to do that. But what it makes it worse is it says the specification should be the tightest specification of any product that would have that pesticide. So, for example, we're having arguments right now, having a pesticide, and we're using a specification of what's in cheap. Because the way the regulation is written, you have to test for 350, and the criteria you have to use is the tightest of all specs for all types of foodstuffs. So the absurdity of that situation is just paramount. What's it driving? Non-compliance. No, since none of us can actually do the test, every laboratory is doing something different. Many of them are not even doing the test. So with the intention of creating the most stringent criteria actually caused the opposite. It actually is causing non-compliance. So really important about regulations.
all right. Now, that sounded like I said, it sounded very much related to what we were just talking about. You mentioned the pesticide test. Tell us a little bit more about this topic. This is the first time I've ever heard of it.
Yeah, so maybe just give you a little pretext of what that little sign, the the video that you just played. I was testifying in the state of Pennsylvania as they're considering adult use legislation, and they asked me to speak about what makes up a good program, and how can they learn from experiences in other states. And I was using just that situation to really bring back to the table that it's really, really important that when creating legislation and specifications, that there's conversations going on between the regulators and the laboratories. And that was just one of the examples I used. So I just want to put that into context. Yeah. So within the state of Illinois, it is, as you might imagine, because there's no federal requirements, every state essentially defines their own specifications. And what the state of Illinois has done related to pesticides is it really essentially says that, and I can actually read it, but what the requirement says is that a cannabis sample should be deemed to have passed it if it satisfies the most stringent acceptable standard for pesticide chemical residue in any food item, as defined in CFR, blah, 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 blah. So what that really does is I said 350. It's actually in excess of 350. I started to count them this morning and kind of gave up, but it's in excess of 350. But what it says is here's are all the different pesticides that cannot be present or cannot be present at a certain level. And it could list of many, many different pesticides. And then it says if you find any of those pesticides, you have to apply the most stringent criteria of foodstuffs. So as I was mentioning, what that really does, it's really a test. And I should also mention in the state is also put in as a statute. So it's really hard to change the regulation. So what does it cause is because it cannot be achieved, it really has caused laboratories to interpret in very, very different ways and in very inconsistent fashion. The great news right now is there has been a new head of compliance in the state, and we're actually talking about literally as we speak. So there is that acknowledgement at the state level. Needs to be changed. So I'm really, really optimistic that over time we'll be able to make changes that are necessary to get a more realistic and relevant criteria for pesticides.
Gotcha. Do you think that consumers have anything to worry about?
No, I don't, because if you go across all the other states that we do business, some states have done a really nice job of looking at what pesticides should we be looking at and what's a realistic spec. And we're seeing more and more states that actually do it based on safety data, where they'll establish the criteria based on known safety data. So I think in general, the public at this point should not be concerned, provided that testing is being done with a reasonable level of specificity. So I think as we get more realistic specifications and ensure all labs are doing it the same way, we'll be in a much better place than we are today.
Gotcha. And anything else with regard to the pesticide subject itself and how it relates to testing?
No, I don't think so. I think again, I'm hopeful with the new individuals in the program that we're going to look to other states and how they've done it, because some states have done it well and some states have not done it so well. So hopefully, looking at it to say, how do we make it? Let's test for the right pesticides, i.e. that could be present in cannabis. Let's make sure that we have methodologies that allow for the detection of those pesticides. And let's ensure that all laboratories are doing it in a consistent fashion, and establishing realistic specifications. When you have all those pieces and parts in play, then we'll have a much more robust program than what we have today.
Gotcha. Now, switching gears a little bit, you mentioned microbiological contaminants and testing with that. I'm curious, like we spoke about before we went on air, I've talked to several licensed operators that they themselves feel the regulations are too strict. And of course, you could maybe consider that anecdotal because they were just, a few operators that I spoke to. But on the other side of that, as a consumer, as I think I also mentioned to you, the weed is just like so dry. It has to be so dry in order to comply with the regulations. And this is what the operators told me. They said, Cole, we'd love to sell you fresh weed. Like, we know how to dry and cure weed to an enjoyable level, but that level is not compatible, for lack of better words, with the state regulations. In other words, you kind of have to, as they claim, over dry your product. Have you heard similar feelings? Do you feel that maybe we went a little too strict with these regulations?
Yes, yes, and yes. So again, comparing and contrasting specifications in the state of Illinois versus others. In general, the microbiological specifications for those that are quantitative, those one meaning that you get a number for, they're about 1/10 the specification for other states in which we do business. So, as I tell people, when you think about microbiological contamination, you really need really two or three things to get microbial growth. You obviously need microbes, you need the bugs, you need moisture, and you need a closed environment. And when you think about weed that's being sold in a package, you have all three. So you will have some level of microbial presence. What you're making reference to is because the specifications are so tight in Illinois, if you remove the water or treat it in other fashions, there are things to sort of remediate weed. But in any case, if you remove the water, you will minimize the amount of microbial growth. So what you're seeing is you're seeing the drying of the product to a much lower level of moisture to be able to meet the specification of the microbials, but now have an impact on the actual quality of the material in that it has to be so dry.
Right. Right. And I don't remember, a few years ago, the Chicago Sun-Times even did a story on this. And to your point, I just found the part where they pointed out in Illinois, microbiological contaminants such as mold, yeast, and various bacteria are measured in colony forming units per gram, or CFUG, with labs culturing them on testing plates to count them. For yeast and mold, Illinois allows up to 1,000 CFUG, colony forming units per gram, but Michigan allows yeast and mold up to 100,000. So, like you said, I think you were right on the dot, 1/10.
Yep.
I'm not a mathematician.
Yeah,
but
yeah. No, that's in general. It is about 1/10, and what we see is with multi-state operators that may be doing business in other states, they really have to modify their weed to be able to meet the criteria, and
right.
they kind of know the consumer experience is impacted, but that has to be done to be able to meet the specification. Absolutely.
Right. And then, to your point, you kind of brought it up earlier. It kind of, this is what this all leads to. The operators have told me, and this is like several operators, not just a few, that they have to employ what they're now calling kill steps. They don't call it remediation anymore.
Yep.
That it seems like remediation would be the idea. If you fail to test, then you would remediate your
Right.
product. And I want to talk to you about that, but really quick, I just wanted to ask if you've heard the same, that most operators feel they have to employ kill steps before they even send it to testing, so that they can almost ensure that it passes testing.
Absolutely. Yeah. Yeah. So, in clarification, remediation is really post failure. What can you do? So, your comment is correct. But there are a number of different types of things you can do as a kill step. There's ozone treatment, there's UV treatment, UV light. There's even some things supposedly that will work where you add a cold or a cryopreservation step, but all those are intended to reduce that microbial burden that I was referring to. And that can work quite effectively. What we're being told about that is taken to the extreme. You'll start to see discoloration of the weed. You definitely will start to see reductions in THC levels in the product. And something we didn't talk about, which is terpenes. Terpenes is another test that we do which is not required, but many of our customers are asking for. Terpenes is another material that's inherent in cannabis that has some its own I'll call it pharmacological effects, i.e., anti-anxiety, allegedly sleep, other things. But it also has synergistic effects with the cannabinoids. But that will also be impacted if it's treated with that kill step. So
Right.
trying to meet the spec really starts to really have an impact on the overall quality of the product that the consumer will see.
Yeah, absolutely. And with all that said, I'd like to first of all establish the fact that, correct me if I'm wrong, remediation slash kill steps is not unique to the cannabis industry. In fact, these tools they're using are from other industries, right?
Absolutely. Yes, they are. Yeah.
Cool. And with that, I wanted to ask the same question I asked earlier. Do consumers have anything to worry about with regard to remediation? And the reason I ask that is because sometimes people hear like irradiation as a form of remediation and they think they're getting like nuclear weed or something. Um,
Yeah.
yeah, can you weigh in? Is
Yeah,
there any reason to be concerned?
there's no indications whatsoever that has any impact on the quality of the product from any kind of residual no treatment material that's being done to do that kill step. That there's no evidence of that at all. They don't need to be concerned.
Thank you. Thank you. And to something that we brought up earlier that I wanted to make sure we touched base on. As you said, remediation is what did you say again? It's like a
So yeah,
afterward
so
step.
yeah, so what can occur is if after all those specific actions we were just referring to, and yet the product still doesn't meet specification from a microbiological side, the material can be brought back and extracted to be able to be used for a different means. So that's what I'm really calling about remediation. Once the material has been treated and still doesn't meet the criteria, there's really no way to bring it back, but other than to extract it into with solvents, and it creates other challenges. But nonetheless, you can extract the THC into organic solvents and then use it for other types of products. And that's oftentimes what people do if it doesn't meet the necessary criteria.
Gotcha. And yeah, that's what I was just about to ask about. So if I could put that in a bottle really quick, and please correct me if I get this wrong, but if a cannabis company sends a batch in for testing, folks, and it fails, they can remediate the sample and extract the remediated product, but for use in an infused product, but it still must pass state testing. Did I get all that right?
That's absolutely right. And solvents will absolutely kill any of those microbes, or essentially the microbiological contamination doesn't come with it because you're using solvents. So what it will do is effectively, I'll call it a kill, but now you have you have material which you then can infuse to other products like a gummy or something like that, edible
Yeah.
product.
Yeah. And similar to that, but not at all related to remediation, to kind of shift gears. I guess before I do that, do you have any other thoughts on kind of the whole topic that we just discussed, remediation, kill steps, stuff like that, before we move on?
No, I don't think so.
Cool. So like I said, unrelated to that, but you just made me think of it because you talked about infusing, an extract into infused goods. I've talked to the Illinois Hemp Growers Association way back in the day, and I'm under the impression that for years now we've had a variance that allows cultivators to use hemp-derived cannabinoids in their infused products. In fact, I just interviewed Maramed the other day, and they spoke about how they choose to primarily use hemp-derived cannabinoids within their state legal infused products. Do you see a lot of that as a cannabis testing lab, like using the hemp-derived cannabinoids in infused products?
Not really. We have been involved in a number of states really looking at what I call the illicit market. And what that really relates to, as you know, you see things like Delta 8 that is available for sale in non-regulated locations like a gas station or so on. And what the Farm Bill absolutely allows you to do is to take hemp, and its major component is CBD, and be able to use that. What we have seen is some groups taking that material and then chemically modifying it to create Delta 8 and Delta 9. And what we have seen in those cases is if it's not done in an appropriate fashion, you start to get a lot of other things which are, in some aspects, hemp-derived intoxicants. So we've seen
Yep.
in situations like that, and I know there's definitely interest in many states about how to ensure the safety of those materials which are available, and looking at potentially having to test them to verify that they have what they, what they are is what's on the label.
Yeah. And I want to get back to that topic because I know that you've spoke about that topic at length. I want to give you the floor to be able to talk about, if it sounds like there is some room for concern on the subject of hemp, at least from your perspective. So, but I'm just curious again, on the hemp-derived cannabinoids in kind of a state-regulated environment. I just find that fascinating, especially given what you just said and what we will be talking about. The reason I find it so fascinating is because to me, it makes economic sense. You can source these materials low, and since Illinois has limitations on the market, you can almost sell them at a higher rate. So I am just curious, like, do people that you work with like use hemp-derived cannabinoids in their infused products, like per the variance allows? And the reason I'm asking is like, I didn't know if it was like they would like even tell you, because at the end of the day, there is really no difference. So like, I didn't even know if they would tell you like, hey, by the way, these chocolate bars have hemp in them, hemp-derived
Yeah.
cannabinoids.
Yeah, we don't. You're absolutely right on. So we don't really hear about it, and nor would there be any reason for them to share that with us.
Yeah.
The only time that we would see something like that is when we do testing. We've done testing of the same product over and over again. We do something called trend analysis, where we continuously look to see how is the product performing.
Mm.
During that trend analysis, we saw something unusual in that we got some additional cannabinoids that we don't typically see. It's our practice to go back to them and say, hey, this product met specification, but boy, it looked different. It was something different. That would be the only time that we'd hear about, oh, we changed sources or we looked at a different source. But it's not very common for a grow processor to share that with us, because we're there just to really see does it meet or not meet the specifications required by the state.
Yeah. Thank you for weighing in on that. And I'd love to give you the floor now. Delta 8 hemp. Before we got on air, you talked about the fact that you've been kind of speaking about this subject and you think there is some room for concern. Tell us about hemp and Delta 8, especially from like a scientific perspective. I'd love to hear your perspective.
Yeah. So as you know, the Farm Bill allowed on a federal level hemp to be consumed, used, and the major component from a cannabinoid perspective is CBD. So definitely hemp CBD direct connection, and done pretty, I'll call it pretty safely. What people have started to realize is they then take that CBD and then chemically modify it. So and they use some pretty, there's a number of ways to do it, but it tends to potentially leave acids because you have to treat the CBD, or other heavy metals because you may have to do some other kind of synthetic work to get to either Delta 8 or Delta 9. And what we have seen, we did some work in Pennsylvania where we actually went on the storefront and actually just went to some local stores and bought it, and it was labeled as Delta 8 product. And lo and behold, of those 21 samples that we tested at that time, only 4 of them actually contained what they said they were supposed to contain about the levels of Delta 8. All the others either had Delta 9 in them, some didn't have any Delta 8, and one that I always use as an example, and actually when I've testified, I use this example on a regular basis. Amazingly so, one material had 1,200 milligrams of Delta 9 in it, which if somebody were obviously to take that, that would just have a profound effect. So the need of being able to really control the quality of the materials that are available, like Delta 8, is really, really important. I have no doubt that there's some companies that are doing it the right way, in that they get the conversion from CBD to Delta 8, really don't have many other things. But because it's such an uncontrolled environment, we have definitely seen other situations where, either because of purposeful misleading of the public or not understanding the chemistry, what they've created is what I call this cannabis soup of many, many different cannabis containing materials, as well as things like heavy metals and acids that were just left over from their chemical reactions, which were not done in an appropriate fashion.
Yeah. Gotcha. And that's thank you for boiling it down to that, because I was about to ask you. People are surprised when I say this, but actually the first time I tried Delta 8, I've got a picture of the product, was in 2019 in an Illinois dispensary. This was a Delta 8 disposable. I'd never heard of it before, but I think, to your point, please correct me if I'm wrong, you're not saying that Delta 8 is, or any cannabinoid really, is that we have any room for concern with regard to just consuming that compound or molecule, if you will. Your concern is the sourcing materials and what might actually be in it, right?
Yeah, I mean, Delta 8 is psychoactive like Delta 9, but that's a whole different conversation. But my focus right now is saying, how do we ensure that that material that is being marketed as Delta 8 is truly what's on the labels in the bottle? And we've got enough information, and we're going to be doing some additional work looking at other, purchasing other materials to see, has it gotten any better, to say, can a consumer purchasing Delta 8 really feel comfortable what they're getting is only Delta 8, and it's at the levels which the label indicates it is. And
Yeah.
right now, I'm not convinced that that's the case.
So I'm curious, what do you think the solution is to that issue, at least from a testing lab's perspective? Do you think it would be that if you're going to sell these products, they need to go through the same types of protocols that other intoxicating cannabis products go through?
Absolutely. That's the solve. That's the solve. Now it's a much more complicated thing, because, as you probably know, you can get these things on Amazon, right?
Right.
So, being able to just go to, a few things, requiring those materials not to be readily available. It should be behind the counter, right? That's one. And some states have done that. Making sure that they don't have labeling which glorifies them, that you don't even realize what, particularly what our children are taking. What is this material, right? So I think being able to make it not as flashy advertising wise is another piece we should do. And then the third one is to have similar types of standards to be able to say, again, what is in the bottle is on the label.
Yeah, and I'm just curious, like, I recently heard similar calls. I won't get too specific because it's in the realm of politics, but I've heard, people call for exactly the idea that you just described, which is like, hey, let's just subject them all to testing so that we can at least make sure this stuff is safe, right? And,
Yeah.
and I feel like that's agreeable, very agreeable. But unfortunately, it seems like some people that may have a vested interest kind of in the market have been like, maybe we don't allow them to sell their products and get tested. So it seems like what first started about a debate around public safety has now become a debate around whether or not, more people should be licensed. I'm curious, as a scientist and somebody who seemingly cares about the public's health, do you what's your perspective on that issue? I mean, safety
Yeah.
or
Yeah, and I've heard this because I testified in a number of states, and it's a tough conversation, right? Because you have, I'm sure, some really good hemp farmers that do a really nice job, and their
yeah,
product is probably as good as any cannabis product, right? And I've met some of those people in some of these testimonies, but it's the same old story, right? You only get the people that get punished are all the people doing it the wrong way, right? And everybody gets punished as a result of it. Punished, I'm putting that in quotes. But I always, when I talk about this, I really talk about it from the perspective of, not only, I have a PhD in chemistry, but I'm also a pharmacist. Um, I can tell you, and I always, through all my lifetime in the pharmaceutical industry, always ask myself, would I give this product to my child, to my parents, to whoever? And right now, I'd say unequivocally, Delta 8, the way it is today, I would not, just because I can't ensure the safety of it. And that, to me, And when you're a regulator, those are things that are obviously the important part of this, right? How do I protect the public? So as much as it has an impact on, I'll call it the good guys and girls that are doing it right. I get that. You just have to say, because of what's out there and the risks of those materials, there has to be greater control.
Yeah. In other words, if I could please correct me on this if I'm wrong. I don't want to summarize your thoughts incorrectly. In other words, prohibition just isn't the answer. The answer really is regulation, you know?
Absolutely. Absolutely.
Well said. Well said. Yeah, that I hate to use a kind of a charged example, but I think it relates here. Some people will say you can't stop abortions; you can only stop safe abortions, and I think that logic applies here. You can't stop the sale of these molecules, or let's call them drugs, but you can certainly stop the safe sale of them if you're not going to let people get regulated and subject them to the same standards. So
Yeah, yeah. Because again, when I'm in those tests, but you hear amazing stories on how these products have helped patients, and so I'm not denying any of that, right? It's just say let's do it in a safe manner. If indeed it has well, it does have pharmacological relevance. Let's at least make sure that how it's being done is being done in a safe fashion.
yeah.
Yeah.
Well, any other thoughts? I'd like to wrap up with one last subject, but any other thoughts on the topic of hemp-derived cannabinoids?
No, not really.
Cool. Well, I feel like I saw you were talking about I didn't see this actually until this morning. That like the Pennsylvania hearing that you had also had like this paperwork that you provided, and you talked about current issues with lab testing, like how consumers will buy based off of THC percentage, which obviously, as you mentioned earlier, maybe they should take into account more things like terpenes, etc. But I'm curious, I've heard of the flip side of that issue since consumers are looking for high THC levels, that there have been allegations that laboratories have you've actually even included that in your you said in some of the worst cases in other states, laboratories have falsified or incentives have been created for companies to laboratory shop for results that yield desired results. Do you mind talking about that a little bit?
Yeah, sure. So when you think about cannabis in general, it's one of the few materials when you think about items that we consume, whereby the higher the THC level, the more a grower processor can charge. And at least today, and hopefully over time that will change, people think the higher the better, right? Without ignoring the fact about, well, there's, as you were just saying, the entourage effect between terpenes and the experiences and so on and so forth. But with that being said, today, the higher THC, the more you can charge. What we have absolutely seen, and I've had personal uh, examples whereby unscrupulous laboratories, and I would say unscrupulous grower processors, are willing to pay for higher potency numbers, even if those numbers are not legitimate. And I'll give just one example. We had, it was not in the state of Illinois, it was one of our other states. When we were bringing on a new customer, his question to me was, well, what's your price for a potency test? And do you have two different prices? And I said, no, we have one price. It's the potency test. And they said, you mean you don't give us an extra, to get a higher number that I can pay extra money for? And this was recent. So
Wow.
it is happening, right? So, and to me, two things happen as a result of that. One is the consumer has an economic impact, right? They think they're buying 30% THC flower and it's 20% THC. That's one.
Mm-hmm.
And a second one, and again, this was a real life example where we were talking to a neurologist where he was saying I was giving cannabis to my patient and they were having seizures. And sometimes they were having seizures and other times they weren't. And I couldn't understand what was going on. And what we came to conclude was the material that they had gotten, they were getting two different sources of material, and one of those materials didn't have the level of THC they thought they did. So here was an example where there was a safety issue, whereby the neurologist felt that the patient should be under control.
Yeah.
suggested them to get certain material, certain THC level, and found out the material, even though it was labeled that way, was not. And actually, they were seizing, and it was a big aha moment for me too. But definitely, it's happening,
Yeah.
and we really need to really get that under better control because nobody wins in that situation. And we really I think it's just really important to again get what's in the bottles on the label.
Yeah. And I'm curious, I don't mean to like poke a hole in the entire business model that you're operating in, but do you think, I'm just curious, some people will jokingly say, well, this stuff's not made in the same place that Tylenol's made. And what they mean by that, I think, is like there's not like when you take a Tylenol, every Tylenol is like pretty well the same. And you've got history in the pharmaceutical industry, so correct me if I'm wrong. But I guess my question is, I'm curious, is it the idea that they're even able to shop around? Because like the whole term third party independent labs make it sound like you're just like randomly assigned a lab, or at least that's how I interpreted it when I first heard that phrasing. But as you
Yeah.
say, you very much are in charge of who tests your product, which I believe can lead to issues. What are your like thoughts about like should there just be one body, or
Well, I think, I don't think you can ever have one body to do testing. I think what we definitely push for, and we're definitely seeing that movement now, is for state regulatory authorities to have their own laboratory, not to do
Mm,
testing of all the product, but to set standards and to be able to be that quote unquote tiebreaker at the end of the day. And we've seen some states do it very, very well, where they continuously look at the data being generated by various laboratories. They trend the data and say, wait a minute, there's something that looks anomalous here. Go back and do this, right? So we're very supportive of having a strong regulatory authority in these states, making sure that they're staffed by chemists that truly understand the things that we do. And I think it will help us set some high level standards to get a greater level of consistency. The other piece that we very much are pushing for is the fact that we should be doing blinded samples. The only way you're really going to be able to see how labs are doing things is to give them material of an unknown potency and send it on to all the laboratories and have them all test it. To have such a program, though, you really need to have a central body to be able to manage that. And we're seeing in various states like Michigan, just recent, they're building a lab. My understanding is Illinois now has location for a lab, and with the new head of compliance really looking to put a lot more teeth into that. We really encourage that. That will allow us to keep laboratories much more honest and to be able to have the necessary oversight that when a patient comes in and gets that product, they can feel relatively comfortable that the material they're taking is free of contaminants and is of the stated potency.
gotcha. And I actually do have one more question. I apologize. I told you that was my last question, but I also have a follow up to what you just said. How is testing done in other industries? Like when I get a beer, it says how much percentage is on the beer. And then I use the example of Tylenol. And then I could even throw out cigarettes. I'm guessing it's all different for each industry, but I'm just
It is. It is, but and I should also mention I was the head of quality at Johnson & Johnson doing Tylenol, so I
oh
know Tylenol all too well. So everything you said about Tylenol is absolutely true. But
oh cool.
the difference in this industry is, and I'll go back to the pharmaceutical or the Tylenol example. There was an FDA, right? The Food and Drug Administration had a control, right? And at the end of the day, there was a group that was continuously monitoring, continuously had oversight, and could do random audits and could do that. And they were very, very well staffed. So in the pharmaceutical, and I call the over-the-counter business like Tylenol, you had a governing body that set standards and enforced them. We don't have that in cannabis. What we do have is we have states, and each state is doing it a little bit different. So as a result of that, the good news is we're definitely moving towards a FDA-like, I'll put it like, approach in that we're putting regulatory bodies in place that have scientific expertise that can set relevant standards. up until the time that cannabis becomes an approved product, do you have like an FDA to be able to manage it on a on a nationwide basis? But right now, where we are is we're doing it on a state by state basis, and some states are doing a much better job than others.
One more follow up before my last question.
Sure.
Since alcohol and tobacco are not scheduled under the Controlled Substances Act, are they subject to those same FDA standards?
There are standards. I don't believe FDA monitors them. I know there. I don't know that answer. I know there
All
was
good.
conversations that FDA was having about controlling um, uh, cigarettes, but I believe that was only e-cigarettes. So I do not believe they have oversight bodies, but I don't honestly know what they are.
Yeah, you get why I'm asking that though. It seems like in other industries, there's like a regulatory body that's just kind of there and you
Yep.
have to answer to them. But here, there is a regulatory body, but there are like these middlemen, these third party independent labs, of which there are many to choose from. And so, yeah, that's kind of where I'm like curious, like, how does it work in other industries? So,
Yeah. Yeah.
gotcha. So last question, and I meant to ask it earlier. You had mentioned, possibly working, and I've heard the state mention this before, that they would be working with the AG to kind of do something about hemp. Um, was it the idea that you'd like be helping them with the hemp testing, as you said, since you do hemp testing, or what's the idea there?
I yeah, my understanding is they want to and again, it's all the states are sort of it's on their agenda about how do we regulate this, and as part of regulation, I think one of the first things is what's out there, and I think so where they're starting with is saying, okay, what are they seeing out in the marketplace, and how do we, based on those findings, how do we then put some level of tighter control with that. So, from what I'm understanding, they do want to start doing some, I'll call it surveillance, sake of a better word, surveillance testing, where they go in and buy product just to see what it looks like, much like what we did in Pennsylvania at the request of the Department of Health. It's a similar type of approach. It seems like Illinois, as are other states, are really starting to amp up this whole area just to see what's out there. And then I think with the premise being once they find that, like, what are we going to do to control it, regulate it? Because my expectation is it's going to be quite varied what we're going to find.
That's very, very interesting to hear. So that's kind of what I thought they were referring to. They had said, that this is a big public safety issue and that they'd like to do something. And I figured I mean, what else would you do other than, checking what's out there so that you can more authoritatively say like, hey, this is a problem, and
Yes.
right.
Yes. Yes.
So. Well, it's been a wide-ranging conversation today, Dr. Miller, and I'd love to have you back on the show sometime to talk about more. I'm sure there's more that we could get into, and I'm sure there's more to discuss in the future. But before we go, was there anything that we discussed today or anything that we didn't discuss today? I wanted to give you the space for the last word.
Yeah, no, I think, at ACT Laboratories, we take our job very seriously. I take my job very seriously in that we're that last step to ensure product going to that marketplace is safe and effective. And, we're very committed to working with regulators to develop a more robust program, with the idea being that, to ensure that safety and efficacy of the products. At an upcoming meeting, I'd love to talk to you about another program that we're working on right now, is about how we can envision how we're going to raise the standards of all the laboratories around the U.S. I would love to have you talk a little bit about that. It's a concept called trust and testing, and would love to talk to you about another time. Is that if we can't expect the product ever to be, the regulations ever be national, is there a way that laboratories themselves can raise the standards, almost like a self-policing approach to raise the standards and above what's out there? So I'd love to come back and talk to you about what that program is and what we think the vision is moving forward.
Absolutely. Absolutely. Well, there's your spoiler for next episode, folks.
There you go.
So, well, cool. Dr. Miller, I just want to say thanks again, folks. The link will be in the podcast description, actlab.com, if that makes it easier, or just type it right into your URL browser. That's a pretty short URL. So, actlab.com. Dr. Miller, thank you once again.
Thank you.